Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Flupenthixol. Its brand name is Fluanxol. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Flupentixol is an antipsychotic medication that blocks postsynaptic dopamine receptors in the central nervous system. This results in the inhibition of dopamine-mediated effects. Now, in terms of indications for use, Flupentixol is indicated to be used in the treatment of schizophrenia in patients whose main manifestations do not include hyperactivity, excitement, or agitation. Before somebody was to use Flupentixol, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. It would be contraindicated in patients who have a hypersensitivity to Flupentixol or other thioxanthines. It would also be contraindicated in patients who are experiencing acute intoxication, whether that be from opioids, alcohol, or barbiturates. This medication cannot be given to patients who are in a coma, and also it cannot be given to severely agitated psychotic patients. It would be contraindicated to be given to geriatric patients who are experiencing confusion or agitation. If a patient has suspected or established subcortical brain damage, they cannot use this medication. It would be contraindicated in cerebrovascular or renal insufficiency. Patients with severe cardiovascular disease are not able to use Flupentixol. It would be contraindicated in patients who have liver damage. And finally, it should not be given to patients who are using large doses of hypnotic agents. In terms of precautions, it should be noted that it may alter cardiac conduction and that life-threatening arrhythmias have occurred with the therapeutic doses of antipsychotic agents. Patients should be made aware that they may experience anticholinergic side effects when using Flupentixol. Therefore, this medication should be used cautiously in patients who have decreased gastrointestinal motility, as well as in patients who have urinary retention. Antipsychotic use has been associated with agranulocytosis, neutropenia, as well as leukopenia. It's recommended to have complete blood counts monitored when using antipsychotic agents. Although Flupentixol causes less sedation on average compared to other antipsychotic agents, sedation still may occur. So patients should be made aware that it may alter their ability to perform hazardous tasks, such as operating heavy machinery or driving an automobile. Diabetic ketoacidosis has occurred in patients with no prior history of hyperglycemia or high blood sugar. Therefore, monitoring of blood sugar and body weight are both recommended. Antipsychotic use has been associated with esophageal dysmotility and sometimes aspiration. In some situations, this could lead to aspiration pneumonia. The use of this medication may cause extrapyramidal side effects, such as akathisias or tardive dyskinesias. Patients should be made aware that there's a risk of orthostatic hypotension. This would be a drop in blood pressure when going from a seated to a standing position. Some patients may find that they lose the ability to control their core body temperature, so they should be more cautious when performing activities where their core body temperature may increase, such as exercise or being exposed to heat or in dehydration. Venous thromboembolism has been reported with the use of antipsychotics, so we should evaluate VTE risk prior to and during therapy. Once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Flupentixol, they can expect to receive their dose either through an intramuscular injection or they can receive their dose orally. In patients who have not yet received treatment with long-acting depot antipsychotic injections, they would start off with a test dose of 5 to 20 milligrams. 5 milligrams would be common in the elderly, frail population. The patient will be monitored over the next 5 to 10 days for signs of extrapyramidal side effects. Patients with prior exposure and good tolerance to long-acting antipsychotics would receive a dose of 20 to 40 milligrams. And keep in mind here, the dosing that we're talking about is for the intramuscular injection. For maintenance, if well tolerated, 20 to 40 milligrams can be given 4 to 10 days after the initial test injection. Then the patient would receive 20 to 40 milligrams every 2 to 3 weeks, again through intramuscular injection. Doses should always be maintained at the lowest possible effective dose, and doses over 80 milligrams are typically not recommended or needed, but they are used in some situations. If somebody is using oral Flupentixol to treat their schizophrenia, they would typically start off with an initial dose of 1 milligram 3 times daily. The dose can be increased by 1 milligram every 2 to 3 days based on efficacy and tolerability. The usual maintenance dose is 3 or 6 milligrams given in divided doses throughout the day. And doses greater than 12 milligrams daily have been used in some situations. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Flupenthixol, so I'll go over some of those here now. Palpitations and syncope have been reported. Extrapyramidal side effects may occur up to 30% of the time. These may include akathisia, dystonia, drug-induced Parkinson's disease, and tardive dyskinesias. Depression, dizziness, drowsiness, and fatigue have been reported. Headache, hypomania, and insomnia have occurred. Psychomotor agitation and restlessness have been reported. And seizures have been reported as well. Some patients experience constipation or nausea. Impotence and urination disorders have been reported. Some patients experience blurred vision. Females may experience amenorrhea. And finally, some patients do experience a decrease in libido. That's all we're going to talk about today with Flupenthixol. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.